you what we do here overall so that I have an idea of how much detail I should go into.
I did none, but I have family members with anxiety and depression that have struggled.
Has anybody else ever gone through the courses on the AMEN website or looked into what we do here specifically and how it's different from another kind of psychiatry office or just traditional psychiatry? So, so the way that the AMEN clinic is different is that we gather data. We like to gather objective information and understand what's happening inside of a person's body, inside of a person's brain that's contributing to the symptoms that they're experiencing. The way that's different from traditional psychiatry is that in traditional psychiatry, it's questions. It's a matter of asking for symptoms. And those symptom clusters then are turned into a diagnosis, and then that diagnosis leads to medications. And so there isn't really the time taken to figure out what's happening inside of the brain and what's causing it, and can you fix that thing so that you don't have to use medications in the first place? Or if you do have to use medications, can you maybe have to use less because you have fixed the primary problem going on? So what I'm going to show you today is a small part of what we do. It's looking at specifically anxiety and depression and how we have been able to determine that there are specific types based on the scanning that we do. So the kind of scanning that we do here at the AMEN clinic is brain SPECT imaging. So brain SPECT imaging is where we're looking at blood flow and function, our activity patterns. So what we want to know is what is actually happening inside of the brain. So I don't have a pointer, so I'm going to go over here and just show you what we're looking at here. So this here is a blood flow scan. So what we're looking at is making sure that every part of the brain is receiving adequate amounts of blood flow. The color does not matter on this particular scan. All that matters is that everything is well filled in and it's symmetric. The back of the brain is here, and the front of the brain is here. This is the underside. This is the only part of the brain that should be bumpy. The rest of the brain should be very smooth. That's important. Over here, this is looking at the activity patterns inside of the brain. So the color gives us the information that we're looking for. So blue is telling us that this is idle activity. Red tells us it's top 15%. And then white tells us it's the top 8% activity. And in a healthy brain, most of the activity is in the back. It's in the cerebellum, which is here. You can see it from the side here, here, and here. So this is a small part of the brain, but it houses half of the brain cells. And so it's very densely packed with neurons, and therefore we see a lot of activity in that part of the brain. Up here are other emotional centers. And that's really what we're interested in when we're doing a SPECT scan, looking at activity patterns, in addition to the health of the cerebellum. So up here in these emotional centers, we want to see just a little bit of red. We don't want to see no activity. So we don't want to see it at idle, but we don't want to see it overly active either. So we don't want to see it red. So the reason that this is important is because this gives us an idea of the health of the brain. So we're looking at a couple of things. First of all, is every part of the brain receiving everything that it needs to function properly? Is every part of the brain getting enough blood flow, getting enough nutrients? And if there is a part of the brain that's not getting enough, why isn't it getting enough? The brain is extremely metabolically active. So if there's a part of the brain that's not receiving enough blood flow, then that part of the brain will begin to suffer very quickly. So that's what we're looking for when we're looking at that surface scan that I just showed you a moment ago. We're looking at areas that are not getting enough blood flow on here. And it shows up as what looks like a hole or it looks like a divot. It also tells us if there are areas that are too active or underactive, and then the question definitely becomes, well, why? And so then we start considering what's the health of the brain, why is this happening in the first place? And so we get clues as to what is happening inside of the brain, and then we go looking. We try to understand what's happening here. So this is where the investigation really happens in earnest. So this is another set of information. So we don't diagnose by a SPECT scan alone. We diagnose based on the symptoms that a person is having, laboratory tests, and also the imaging. So Dr. Amen has been doing brain SPECT imaging for 30 years now, and he has the largest bank of SPECT scans. And because he's been doing this for so long, he's been able to determine that there are these types of anxiety and depression. So one of the types that he discovered was pure anxiety. And when we see this, is high basal ganglia activity. So you can see those two spots here and here. Those are the basal ganglia right here. And remember that other picture I showed you, there were just those little tiny red spots. And that's all we wanted to see. And remember, the white is the highest amount of activity. So this is telling us that the basal ganglia are way too active. And when they're active like this, there's just so much going on that a person can end up feeling very tense and anxious and very nervous. They may have panic attacks that are coming right out of the blue and not understand why this is happening in the first place. And so it's important for us to figure out why is this going on. Many different reasons why this is happening. Now, again, we don't diagnose based on just SPECT scan alone, because sometimes people will have a lot of activity here, and this part of the brain is really helping them. It may be that the worry they're experiencing is appropriate and motivating and actually helping them to set goals and meet their goals. So as long as the worry that they are experiencing is manageable and is helping them in their lives, then we don't do anything about this. But if what they're experiencing is making them feel paralyzed, making it hard for them to get traction in their lives, then we definitely do something about this. So what we usually see when someone comes in, as far as a DSM diagnosis goes, is they might have been diagnosed with generalized anxiety disorder if they went somewhere else, or they might have been told they have a phobia or organic disorder if they went somewhere else, or social anxiety disorder. What we do is, of course, always try to figure out why is this happening in the first place. So blood work, extremely important. We want to know, is there some sort of an imbalance going on inside of the body? So that's looking at things like the thyroid and the adrenals and things like heavy metal balance, copper and zinc. I'll talk a little bit more about that at the end if anybody is interested in that. Things like methylation status, which is going to affect the amount of serotonin, the amount of dopamine in the brain, and various other things. And when it comes to how to help them, of course, we treat those imbalances that we found, whatever kind of biochemical issues that we found. And then we talk to them. We ask them, where are you at? Are you wanting to use medication? Are you wanting to use supplements? Because we want to always be in alignment with where the patient is at. If they want medication, then generally speaking, we always want to get the most information so that we are doing things from a very personalized perspective. So we talk about pharmacogenomic testing. Is everybody familiar with pharmacogenomic testing? Yeah. So pharmacogenomic testing is very simple. It's actually just a cheek swab, and it gives genetic information on the enzymes in the liver that break down medication. So it tells us whether or not a person has enzymes that are going to break down medication too fast or too slow or just right. It also tells us if a person has certain genes that are going to interact with medication in a way to deactivate the medicine, so it'll never really work in the body. Or if a person has inherited certain genes that may be impacting their emotional well-being, and if they have those genes, we need to do something about it. So very important information, and saves us a lot of time of just basically throwing darts in the dark when it comes to guessing about medicine. So we have an idea when a person has this type of finding on a SPECT scan, we know that their brain needs to be settled down. We know they need GABA. But we don't necessarily know which medicines are going to work specifically with their body. So that's where the pharmacogenomic testing comes in. If they choose to do a more natural approach, then we're thinking about other ways to settle down the brain. So things that raise up GABA, things like lemon balm and valerian and magnesium and B6 and kava, those sorts of things. And then of course, always, always things like, we're very holistic in our treatment plans here, so we always are going to discuss things like therapy and diet and exercise, and of course, what is their situation like at home? What kind of support do they have? What kind of social support do they have? What's their spiritual connection? Okay. The next type is pure depression. And in pure depression, what we see is the deep limbic system, which is right here, very lit up. So this is this bright white hot spot right there in the center of the brain. And when we're seeing this very lit up, sometimes a person has these chronic, very kind of sad feelings, and it may be consistent where they just kind of drag, and they might have kind of a low energy. They might feel just kind of like they don't enjoy life very much. So anhedonia, maybe some apathy. They may have negativity. They may have guilt. They may have a sense of hopelessness, and they may have this chronic low sense of self-esteem as well. Now, again, we don't just diagnose based on the SPECT scan alone, because some really nice qualities can come out of this part of the brain being very active. And oddly enough, it does tend to be more active in women. So this part of the brain for some people just allows people to have a much more rich emotional experience of life. So it can allow them to feel very sensitive, very empathic, be a person who is very deeply connected, able to really pick up on the emotions of others. So they tend to make very good friends, very good family members, because they're kind. They really care about the well-being of other people. They can be extremely sensitive, and that can feel like a double-edged sword, though, for a lot of people, so they can feel as though they're emotionally flooded, because these can be very empathic people. So with these people, if they are experiencing the negative impacts of this part of the brain having a lot of activity, we talk to them about things like grounding and boundaries, making sure that they really understand how to honor their own needs and protect them. So what might we see in the DSM? Dysthymia and depression. So dysthymia, definitely. These are people, or you might have heard double depression. So people that have major depressive disorder and then also dysthymia. So just kind of stays low. Maybe pops up and then stays low again. What do we do? So again, labs, we always want to know, why is this lit up? And I'll tell you, with COVID happening, one of the things that we ask about is infectious exposures. And that goes with this type and also with the previous type that we just looked at a moment ago, because infectious exposures do tend to light up these emotional centers and cause some difficulties here. And we need to settle it down, settle the immune system down, and get the immune system working properly again if this is going on. Again, if they want medication, pharmacogenomic testing, because we know that this part of the brain responds to certain medications, certain types of medications, specifically those that work on dopamine and norepinephrine. But we don't know which of those medications will be better accepted inside of the body. So we always want to know that information so that we can get them feeling better as quickly as possible. If they choose...
I think you saw that I've ever seen.
Oh, I know, isn't that
It made me
sweet?
happy just looking at that.
I know, it did me as well, so I just wanted to share. As far as supplements go, we want to think about things like SAM-E and the omega fatty acids and saffron. Has anybody heard of saffron, by the way, to be used for depression? Of course, saffron is a spice. We use it for cooking. But oddly enough, in India, when someone is happy, they say, "Oh, you've had your saffron today." And now it's been studied. It's in PubMed. There are now, I think, 14 different articles in PubMed, which is the repository of information from the National Institutes of Health, showing that this is actually an antidepressant. Saffron, just a simple spice. It's amazing. It's like a sunshine spice. We want to do cognitive. Yes.
Is it good for anxiety as well?
It absolutely is good for anxiety as well. Yes, because it does have a little bit of a serotonin quality too, which we're going to talk about in just a moment. Yeah, you're welcome. And it's an anti-inflammatory, and inflammation can also create anxiety. Cognitive behavioral therapy for these people is very important because when a person has a lot of activity here and they tend to have that sort of negative view on things, there tends to be something called a negativity bias. And negativity bias is where they tend to just see the negative in situations. Excessive worries, excessive fears, excessive personalization. And that really needs to be addressed so that a person's view of things or their reality, their experience of reality is more in alignment with what's actually happening in one's life rather than having a negative spin. So cognitive behavioral therapy, where they learn how to recognize where these negative thoughts are at and to do something about them. Exercise. Exercise has been studied head-to-head with antidepressants and been found to be just as, if not more, effective than antidepressants, especially high-intensity interval training. Wonderful kind of exercise. Diet, definitely focusing on getting in good amounts of protein, healthy fats, lots of vegetables, extremely important. Omega-3 fatty acids, as I mentioned, especially focusing on DHA. DHA is very calming inside of the brain. EPA, extremely important as well, especially if a person has difficulties in their prefrontal cortex. Okay. Mixed anxiety and depression. So this is where both of those areas are lit up, both the basal ganglia and the limbic system. And so as you can see, it's both of those areas that we just went over. And this is now a combination of symptoms that we just discussed. So these people are anxious and they're sad. And they may be having panic attacks. These things may come right out of the blue. And they may not be able to put their finger on why they're sad. They may just feel, I have everything in my life I want, and I'm just not feeling it inside. Why am I not feeling it? So again, treatment, which we talked about already. Going on to the next one is anxiety and depression that is associated with overactivity in the anterior cingulate gyrus. So these people are over-focused. So the anterior cingulate gyrus is right up here. It's that strip. So this is an interesting part of the brain. I wish I could show you a side view. It's essentially like a mohawk. It goes from the forehead all the way to the back side of the head. And for some people, it is lit up like a Christmas tree. And when it's lit up like a Christmas tree, their focus is stuck. It's really hard for them to shift it. And that can be especially problematic if they also have a lot of activity in the basal ganglia and the limbic system because they're stuck in that place of anxiety and negativity. So symptoms here, they're stuck. So they have senseless worry that they can't stop thinking about. They tend to focus on it and they ruminate. So these are people that might wake up in the middle of the night and immediately their brain starts going over and over and over and they just can't stop it. Things that they don't want to be thinking about, they just can't quit. They may also immediately say no. If someone says something, it's no. And Dr. Amen has a very funny story about his own father who, it turns out, has a lot of activity in this part of the brain that he shares in his lectures. that he would ask his father for something growing up and the immediate answer was no, unless it was his idea, and then it would be yes. So that's typically what you get in this part of the brain. Everything is no. There also tends to be a sense of being oppositional. That means that people that have a lot of activity here don't like others to tell them what to do. So this can be especially difficult when you're trying to help them with medicine or with supplements or whatever it may be. So if you have someone in your office and you're telling them, yeah, I think this may be the thing that's going on, and let's go ahead and try this, and they say, oh no, I've done that. Okay. Well, let's go ahead and try this and say, oh, no, that won't work. I know that won't work because this other person did it and that's not going to work. So this is someone who kind of has that oppositional stance to anything that you bring up. They might also have compulsive behaviors. They may have obsessional thoughts. They may have loops. So OCD can come from this part of the brain, just loops over and over and over again, and they can't get off of that part or that way of thinking. Tendency to hold grudges because they're stuck. So if they have that way of thinking, they get stuck in that tendency to hold grudges and argumentative and a hard time seeing options in life. So they get a certain way of thinking and they can't see other ways of thinking. And they tend to also have something called excess error detection. Excess error detection is where a person can see problems even where they don't exist. So for instance, having error detection is important. Error detection is when you can walk into a room and you can see that something has changed. Or you're at work and you can see that something needs to be fixed, so you fix it. But excess is when you see problems everywhere, even where they are not occurring. So for instance, a person can turn this inward and see problems in themselves even where they don't occur. So they can really beat themselves up. And problems like eating disorders can come out of this because they're just sort of ripping themselves to shred. Self-esteem issues. Or a person can turn this outward and become very critical of other people, and this can cause problems in relationships as well. So when a person comes in, they typically already have a diagnosis of things like OCD, maybe anorexia, eating disorders. They may also have addiction because if a person has a tendency toward addiction, they have a hard time not thinking about the thing they're addicted to, and therefore it's hard for them to get over the addiction. They may also have an oppositional defiant disorder, and they may have tics. Okay, so what do we do about this? So really important to help them recognize what's happening inside of their thought process and to stop it. And so definitely thought stopping kind of techniques, going into therapy. If they have OCD, it would be exposure response prevention, helping them to really gather an awareness. But they need serotonin because this part of the brain, when it's lit up like this, it tells us that there's a lack of serotonin. So serotonin can be raised up either naturally or it can be raised up with medication. So once again, pharmacogenomic testing to determine which medicine will work in their body if that's the way they choose to go. And then we're thinking about things like SSRIs or maybe SNRIs. And if they want to go naturally, then we're thinking about things like 5-HTP or things like the B vitamins to help raise this up. SAMe can help to raise this up also. This is where the labs are also very important because people may have a methylation disorder or an MTHFR deficiency. Are you all familiar with MTHFR deficiencies? So an MTHFR gene is something that we all inherit from mom and dad. We get one copy from mom, one copy from dad. And if we have normal copies, then we can convert folic acid into L-methylfolate perfectly fine. And then all of that can cross our blood-brain barrier and be available to make neurotransmitters. But if we get one bad copy from either parent, then our ability starts to go down. If we get two bad copies, then our ability is severely impaired. And now we have very limited ability to convert folic acid into L-methylfolate. And now we have very limited amount that can cross our blood-brain barrier. So we have a bottleneck inside of our brain of the building blocks that are needed to make our neurotransmitters. And this is problematic. Now people are going to be deficient. So we have to do something about this. We can't change their genes, so what we have to do is bypass the bottleneck. We give them L-methylfolate. So that's an antidepressant for these people. This is something that we tend to see also in kiddos. So when children come in and they have a lot of activity in this part of the brain, we want to send them to functional medicine and do a workup because there tends to be some sort of a neuroinflammatory component, and that warrants investigation. What's happening? Why is there neuroinflammation in the first place? Especially with kids, there are things like PANDAS and PANS where there's a neuroinflammatory process going on. And we want to make sure that we discover the reason for the neuroinflammation and treat it and get it out of their body so that they are not having this problem into the future. Okay. The fifth one is temporal lobe anxiety and depression. And the temporal lobes are kind of right here behind your ears a little bit. And so on this scan, you can see here that you've got a lot of activity. So the temporal lobes are involved in things like helping us with mood regulation, mood stability, temper control. If we have some trouble here, then we might be irritable. We might have rage. We might also have mood instability, lots of ups and downs. There may be panic attacks, even that come right out of the blue. There can also be a tendency to misinterpret what's happening around a person. Paranoia can come out of this as well. Memory problems can come out of this because the hippocampus actually runs right inside of here, and that's the part of the brain that lets us convert short-term to long-term memories. And there could also be some trouble with things like coming up with a word we want to say to express ourselves, and reading, and also social cues, understanding social cues. So this is often triggered by a brain injury. So I wanted to go ahead and put up the other kind of scan that we do, which is looking at blood flow, because I wanted to show you that brain injury specifically can cause problems with the temporal lobes. So temporal lobes are here and here. And when you see those little things that look like holes, that tells us that this part of the brain is not receiving enough blood flow, and therefore this part of the brain is going to begin to suffer. If you look at the skull, the underside of the skull has these, I wish I had a model at home, I wish I brought it. It has these bony ridges on the underside where the brain sits, and it's very sharp. In fact, if you put your finger in there, you would cut your finger, it's that sharp. And our brain is so soft, it's the texture of tofu, and our brain actually floats inside of our skull. So when something happens, like you get your head hit, our brain bounces. And so you get what's called coup contra coup injury. That means injury at one side and also the opposite side. So you get microvascular tearing at both sides. What happens then inside of the brain is it sends an inflammatory reaction to that area because it wants to heal those microvascular tears. And for some people, they can get stuck in that place of inflammation. So the scan that we just looked at on that previous page had those little red spots, and that was showing increased activity. That's that inflammatory process. But here, you can see that there are microvascular tears, and it's not getting enough blood flow, and therefore coup contra coup injury. So when this part of the brain is suffering, what we know is that it needs to be stabilized. So treatment is things that are going to raise that GABA. So sometimes they need things that are going to help with the sodium channels, sometimes the calcium channels. So we think of anti-seizure medication. So again, if they want medication, pharmacogenomic testing. If they are interested instead in doing something naturally, then we raise GABA. So that would be things like GABA, valerian, magnesium, lemon balm, as I mentioned previously, and a variety of others as well. when we think about omega-3 fatty acids, we're going to think about things that are going to calm the brain. So the DHA component of omega-3 fatty acids needs to be higher for these people. We also want to think about therapy because they definitely got to learn how to get control over some of these reactions once we settle down their brain a little bit. And they need protein in their diet, most definitely. And they also need hyperbaric oxygen therapy because they need to have the parts of the brain that are struggling here healed. So hyperbaric oxygen therapy is wonderful when a person has had hits to their brain or they have had concussions. So when people do hyperbaric oxygen therapy, they're getting inside of a chamber and we're raising the pressure. And they're also breathing in high concentrations of oxygen through a nasal cannula. So we're hyperoxygenating their body and brain, and we're pushing this into the deeper compartments. And they're in there for about an hour. And they're doing this over consecutive treatments over time. So studies have shown that when people do this over time, they start to grow new blood vessels. It's called angiogenesis. So these areas where we see the little holes, they begin to fill in. We also see increased stem cell production. Even after just one hyperbaric session, you can check their blood and you see increased stem cells circulating. That means they're growing new brain cells. And it supports mitochondria. Mitochondria are the engines of our cells. If we don't have good mitochondria function, then everything kind of dampens down. So it's very important. Okay, let's see. Oh, I'm sorry, I think. Okay, I apologize. This should actually say cyclic anxiety and depression, as you're seeing here at the top of this scan. So it's overactivity throughout the brain and the emotional center. So I'm going to go back to this here, but just know that this is overactivity all throughout the brain. And so these are people who are just sort of lit up all over the place. There's some kind of an inflammatory reaction going on inside of the brain. So when a person has this, they tend to be very irritable. They tend to have some decreased or increased need for sleep. So they may have a diagnosis of bipolar disorder. They may have racing thoughts, pressured speech. They may be just kind of all over the place, very impulsive, very irritable, maybe grandiosity. There may be some psychosis going on as well. Just way too much activity everywhere. And when they come in, as I mentioned, they might have a diagnosis of bipolar disorder or a cyclothymic disorder. We definitely see brain injuries in people that have this sort of an issue. They may have a psychotic disorder and they may have been diagnosed with PMS as well. PMS actually is very interesting. The brain changes depending upon this cycle. The anterior cingulate gyrus can get much more active. So treatment. So we definitely want to understand what's happening. Why is the brain all lit up? And this is an inflammatory response oftentimes that's happening inside of the body. So functional medicine consultation is definitely warranted. And we work with a lot of functional medicine doctors here at the AMA clinic. And oftentimes the problem is in the gut. So GI testing, trying to understand, is this a problem with gluten, with dairy, with sugar, or is this something else? Is it some sort of an immunologic response that's going on, or an autoimmune issue that's going on? So functional medicine workup first and foremost. Also want to know, do they have an elevated copper issue? So this is important really for any of these various types of the brain, specifically when a person has a lot of anxiety. But when we look for copper, we're basically looking to see if they have a problem that's lowering dopamine and raising norepinephrine, and therefore putting the brain in an excitatory state and a depleted state at the same time. And we need to fix that if it's going on. One of the reasons this might happen is that there's an infection going on, such as neural Lyme sometimes in some cases. In the initial part of the infection, neural Lyme can be a very long process, but in the initial part sometimes this can be going on with a lot of activity, and the body actually tries to sterilize things by raising copper oftentimes. We want to settle things down with DHA fish oils, obviously stress management, obviously exercise, and we want to stabilize the mood. So we're thinking about things like GABA and lithium, so we're thinking anti-epileptic medications and potentially antipsychotic medications as well. Okay, type 7, this is really unfocused anxiety and depression, so nobody wants to see a brain looking like this. Way too many holes. So this is the underside surface of the prefrontal cortex, and you've got these big gaping holes, especially here on the underside of the prefrontal. So this is where executive function lies. So things like attention and focus, being able to do things in a linear fashion without being all over the place, being able to do things quickly as opposed to procrastinating, to complete tasks as opposed to having a lot of loose ends going, be organized also. And so we want that part of our brain to be functioning very well. So if a person is having this kind of an issue, then they may have those symptoms. They're distracted. They may look like they have ADD. They're distracted. They're kind of all over the place. They may feel as though they have a hard time thinking in general. But they are also having trouble, as you can see, in the temporal lobes. And so they may also be having trouble with things like mood stability and feel kind of all over the place, kind of anxious. This is the backside of the brain in somebody who has this particular type of anxiety and depression. And you never want to see this either. So obviously the neocortex is the part of the brain that should be smooth. We always want to see this getting a good amount of oxygen. But what we're seeing here is that these holes are representing areas where the brain is not getting enough oxygen, not getting enough nutrient delivery, and therefore a person is going to begin to suffer. So these are the people, when they come into our office, they're chronically depressed, they can't think very well, and they're treatment resistant. So they have treatment resistant depression. The reason they're treatment resistant is because depression is really not the issue. So it's not an issue of just not having enough serotonin or enough dopamine. Something else is going on. So when we see this, we need to look for things like mold exposure. We also need to look for things like carbon monoxide, because this is a lack of oxygen. So did they have some kind of an insult at some point in their lives? Did they have anesthesia where their O2 fell or their blood pressure fell? Could there be a chronic inflammatory response? So I mentioned Lyme a moment ago. So when Lyme, in people that develop chronic Lyme, they can develop this. Initially, they can develop neuroinflammation. Also hypothyroidism. There's just sort of a lack of energy all over the place. And a variety of other things can do this as well. So really important to do investigation for people who have this. Functional medicine, always we need to do a functional medicine evaluation on these people because they're not going to get better. We cannot give them antidepressants and expect them to get any better because, as I mentioned, serotonin, dopamine, those aren't the main problems. So labs, doing a deep dive, doing some investigation. We do need to support their brain. We need to give their brain more energy. So we are going to do some pharmacogenomic testing if they want to have their brain supported with medication. If they're looking for nutrient approaches, then we're going to think about things that are going to raise up energy. So ginkgo biloba and EPA fish oils and the B vitamins and folate, ginseng. We also want to think about TMS. So TMS, transcranial magnetic stimulation. TMS is very interesting. So this is where you have a magnet that's basically run over the front side of the brain. It can be done in a doctor's office or at home. There are some home treatment options. And essentially what it's doing is helping specifically with this part of the brain right here. So the left part of the prefrontal cortex, when this part of the brain is suffering, we tend to have depression. Things kind of just turn way down. And when you do TMS, it's specifically targeting that part of the brain to turn the lights back on, to get energy to that part of the brain. So it's a really nice non-pharmacologic way to turn things back on there. And of course, we're thinking about exercise. We need to get them moving. We need to get their blood flowing. We need to get oxygenation going. So we're going to want to get them in the hyperbaric oxygen therapy chamber as well. We're going to make sure that they are eating really good, healthy foods, lots of nutrients. For all of these, we're really thinking about some basic nutrients, like a good, nutrient-dense multivitamin, making sure that their vitamin D level is where it needs to be, because low vitamin D level is associated with depression all by itself, no other issues at all, and is a risk factor for dementia. So vitamin D level needs to be between 60 and 80, just a little tidbit. Magnesium levels need to be in the right place as well. A lot of the country, in fact, it's estimated 80% of the country is magnesium deficient. And once we are deficient in magnesium, our need for magnesium goes up even further. And then we have more and more anxiety, and around and around it goes. So that needs to be addressed as well. And then omega-3 fatty acids. The reason omega-3 fatty acids are so important is because it is a natural mood stabilizer, natural antidepressant, natural anti-anxiety supplement, and natural ADD supplement. And we are terribly efficient in this country. So we tend to check something called the omega-3 index on our patients. And that tells us if they have enough of the omega-3s in general, but specifically what I'm interested in is EPA and DHA. EPA and DHA are the two forms that are shown to be very helpful for cardiovascular, for brain health. What's good for the cardiovascular system is good for the brain. And often in my patients, I'm finding that their number is somewhere around 2.5, 3 if they're lucky. I rarely see anyone above 3, but you need to be above 8. And so we tend to be just very deficient. And so getting that up is extremely important. The brain tends to be much more vulnerable to things like problems after a head injury if the omega-3 fatty acid level is low.